able to join today. So please look for the recording and feel free to share it with colleagues who you know are interested in this topic. With that, I'm going to hand it over to Beth Brogard, and thanks again for attending this brown bag.
Thank you, Tab. I'm actually just going to hand it right over to the second Beth on the call, Beth Lacroix, who is going to walk us through the presentation. Over to you, Beth.
Thank you, Beth. Hi, everyone. So good afternoon, good morning, good evening. Thank you all for joining. My name is Beth Lacroix, and I am a technical advisor for performance metrics at PSI on our strategy and insights team. I'm really excited today to present our review of demand forecasting for new and lesser used contraceptive technologies, our set of recommendations, and how we have applied some of these lessons learned within the EECO project. So let's go ahead and dive right in. Just as some background, we all know that there is a large unmet need for modern contraception in LMICs. Estimated 218 million women have an unmet need for modern contraception. Most cited reasons for this are due to concerns about health risks, fear of side effects, unwanted changes to the menstrual cycle, and due to infrequent sex. So we know in EECO, new contraceptive technologies have the potential to increase modern contraceptive use and improve client experience, especially fulfilling a need for those who would choose a modern method if it better matched their preferences in terms of side effect profile or an on-demand method versus one that required continuous use. When we're looking at new methods of contraception, estimates of market size and demand forecasts are commonly used to inform decisions around introducing new contraceptive products, from early research and development investments to plans for initial procurement and launch in country. Accurate forecasting helps us inform better decision-making and can reduce over or undersupply and optimize the use of limited resources. If you procure too many of a method, of course, money is wasted on products that will not get used. That could have gone to webinar.
You're welcome.
And procure too little of a method, and we may have women going without a method they would have wanted. There, of course, are many challenges to forecasting demand for these new methods, as there is typically no or very limited historic data on product use. And there's very little published guidance on this topic. We built upon an existing guide that was published by the Reproductive Health Services Coalition in 2012 to incorporate lessons learned in the last decade around the introduction of contraceptive implants, hormonal IUDs, subcutaneous injectables. While the original guide focused on demand forecasting for immediate procurement decisions, we wanted to take a bit of a broader approach across the product life cycle, including lessons learned for products that are still in early development phases. So our goal here is really to support sound, forecast-based decision-making and accurate data interpretation for new and lesser used contraceptive technologies within the global health community. To do so, we've examined and described the methods, assumptions, and purposes of common forecasting approaches and have pulled together a set of recommendations and best practices to apply. We began the process with a landscape review of the peer-reviewed and gray literature. We used the literature to clarify some key terms and concepts and primarily to lay out a conceptual framework, which we developed into our key informant interview guide, in which you'll see in the next coming slides. We then interviewed 29 key experts to refine our framework, incorporating their feedback, updating the framework and our guide after each interview. We selected experts in demand forecasting and market estimation, specifically those with an expertise in contraceptive products not yet available at scale. Experts represented a range of both producers and consumers of forecasts, including donors, manufacturers, technical assistance providers, institutional buyers, as well as the Ministry of Health official. We coded the notes from each interview using some thematic content analysis, and then we used the insights from this analysis to develop our key recommendations and our final manuscript, which we have just this summer submitted for publication. So with that, you get to dig into the findings. So we found that forecasts inform many different decisions across the product life cycle. Across the top, you'll see the product stage from research and development to products that exist but are not yet introduced at scale to those that are widely available at scale. Below that, we have the pink box that lists the primary users of the forecasts, which essentially follows the product stage from product developers through manufacturers and donors to institutional buyers and implementers. The next set of big white boxes really starts to detail what types of decisions are informed by forecast results at each product stage. So the far left box covers both early and late research and development. Here, decisions tend to be around developing new products responsive to consumer needs, advocating for investments, investing in product development, as well as trade-off decisions within a portfolio. These forecasts tend to be long-term, looking years and in some cases decades into the future. The middle white box covers products that are not yet introduced at scale. Here, decisions can be around advocacy, investments, and planning for country prioritization and regulatory steps, market shaping interventions such as access pricing, or national product introduction plans. These forecasts can have more of a mid-range time horizon on the scale of a few years. And finally, on the rightmost box, forecasts here tend to inform supply planning for distribution, as well as production planning for manufacturers. This is mostly applicable to products already available at scale, but in some cases can apply to products that are ready to be broadly introduced. These types of forecasts tend to be much shorter term, such as quarterly. So we next dig into what some of the common inputs are when we're looking at these demand forecasting models. So again, starting on the left from R&D decisions towards the middle for introduction planning and market shaping interventions, and across to the right for production and supply planning. Across all purposes, key data inputs really come from consumer research as well as demographic data. Consumer research asks how likely a woman is to take up this new method of contraception. It gets us to that key piece of information of uptake or conversion rate. This research can, of course, take many forms, such as target product profile exposure, discrete choice experiments, simulated test markets, existing survey data, such as from DHS, MIX, or PMA, and can even pull from focus groups, clinical trials, or pilot studies. Any data that we have available to get us to that estimated conversion rate. We then apply that conversion rate to our demographic data to estimate the number of women who would potentially use a new method of contraception. In addition to consumer research and demographics, other approaches are often developed in tandem. With new products, we don't have context-specific historical data, but we can use data from a proxy product or proxy market. For example, looking at data on the copper IUD when estimating demand for the hormonal IUD, or looking at the introduction of a product in Benin to predict uptake in Togo. Word of caution, selecting a good proxy product has its own set of best practices, which we'll not cover in today's presentation, but is covered in our paper that we, in the manuscript. And finally, when bringing a product to market and for production planning, it's really important to consider context-specific constraints and opportunities, such as capacity for service delivery, funding phase for a national program plan. This really serves as a reality check for the original forecast. There are some cases where this variety of approaches provide drastically different estimates, and then we really turn to expert opinion to reconcile those differences. Finally, we also saw that, of course, different model outputs vary across different forecast purposes. In terms of output units, output types, time period, single method versus method mix, as well as disaggregations. The key things to really take away in terms of the different outputs is, one, it is difficult to translate well between different output units, particularly between users and units of a product. And this is after a forecast has been developed. So this really highlights the importance of deciding on what output unit you need before actually creating the forecast. Output types as well vary from single point estimates to ranges to rating systems to market shares. And our key takeaway from this piece again is that it's also very important to acknowledge uncertainty in the type of output, as well as avoid implying false precision. Confidence intervals can acknowledge uncertainty, but also may provide false precision when based on some of these broad assumptions. And finally, looking at a single method versus the full method mix is one of the other key takeaways from this. That it's really important to consider a forecast for the entire method mix when making decisions around prioritization of funding, and really to keep in mind presenting an option within the full range of contraceptive choice and taking into account the possibility of market cannibalization. So across our key informant interviews, we found three main categories of insights regarding selecting the approach, actually conducting the forecast, and communicating results. When selecting an approach, all key informants emphasize the importance of choosing an approach that's fit for purpose. Communicate this purpose and intended use clearly, and let this guide your approach, of course, while keeping resource constraints in mind. When conducting the forecast, it's important to consider the effect that method switchers will have and the effect that this will have on the method mix. So look at constraints and also then to look at constraints and opportunities to reality test the forecast results. Even if there's a high demand for a product, can the health system keep up? Are there enough providers? Is there a steady funding stream? This becomes even more important when the forecast feeds directly into a supply plan. And finally, when communicating the results, it's really important to clearly articulate all of the assumptions. As we mentioned, acknowledge uncertainty in the forecast. And this one often gets forgotten, I think, is revisit the forecast and refresh the results once you have some more data and once you know if your assumptions were correct. And so we took these insights and results that we have and compiled them into a few key recommendations. So first, we really recommend following a really simple decision pathway when developing a market sizing or forecasting approach. Our key informants emphasize the importance of choosing a model that's fit for purpose for the intended forecast consumer. And so when deciding what decision will be informed by this market sizing estimate or demand forecast, work closely with stakeholders and really clearly determine the goal of this. Deciding whether to invest in the development of a new product requires a different approach than creating a national introduction plan for a new method. The outputs, assumptions, and inputs all cascade from this first step. So it's important to get it right and to have it clearly articulated. So second is then articulating what outputs do you need to answer this question. Keep in mind, again, it is difficult to convert between units or to convert between units well after the forecast is complete. So do you need the total number of users or the total number of products procured? It's also important to determine how to account for uncertainty around the outputs. Consider how a range of uncertainty will affect the forecast decisions. Many of our key informants recommended creating an average estimate with best and worst case scenarios, and of course, clearly articulating the assumptions for each scenario. And finally is determining what inputs and assumptions you need to get those outputs. Clearly lay out all the inputs needed. Ideally, we'd have the time and resources to be performing, discrete choice experiments and consumer research for every forecast. Unfortunately, in many cases, that's not an option. And so determine what inputs best meet your needs while keeping those research constraints in mind. Assumptions should also be clearly articulated and based on the best available data and expert knowledge. We also recommend getting stakeholder buy-in to these assumptions and document them clearly and make them available with the forecast whenever possible. So while following the decision pathway and really clarifying the intent and needs for the forecast will help deliver more clear and valid results, there are other factors that can affect the accuracy of a forecast. These are some of the common pitfalls that our key informants raised during the interviews. most of which can lead to results in overestimates in market size and demand forecasting, which can lead to poor use of the limited resources that we have available. The first piece here is accounting for overstatements in consumer research. We know that there's a tendency for overestimation, exaggeration, and desirability bias when incorporating consumer research data. So one suggested approach is to weight survey responses regarding the likelihood of method uptake, discounting someone who says, I would probably use more heavily than someone who says, I would definitely use. And another option is to consider consumer satisfaction with their current method of contraception. Those who are already highly satisfied with their current method may be less likely to switch to their new method, and we may want to discount them a little bit. The second piece is around failure to account for method discontinuation. For new methods of contraception, they'll be limited to no data on discontinuation rates. Applying rates for a proxy product with a similar refill profile can help reduce some of these overestimation errors. However, even small periods of product discontinuation can have large impacts on a forecast over time. While a consumer may report consistently using a method of contraception, there still may be extra time between refills or skipped doses. One of our key informants noted that individuals may easily overestimate their yearly use by an entire month. When we applied this to a scaled up forecast for a population, this could lead to a substantial difference in actual use, regardless of the accuracy of other model inputs and assumptions. And so really to consider discounting for consumer self-report around use. And finally, many forecasts focus only on a single method of contraception. Study participants who are not aware of the full range of contraceptive options may say they would use the new method when they would actually be more interested in adopting an existing method if it were accessible and presented in the same way as the new method. A single method demand forecast can also fail to account for the likelihood of market cannibalization, that is, users switching from an existing method to the new method, which would reduce the impact of the new method on MCPR. When possible, it's important to estimate not just the uptake of the new contraceptive method, but to contextualize it within the full method mix. This allows us to better understand the actual likelihood of uptake and the balance of the costs and benefits associated with introduction. Next, we're going to look at how we incorporated some of these best practices and lessons into a market sizing estimate for a new contraceptive method in the Philippines. As of 2016, there were over 100 period tracking apps available on Android and iPhone operating systems. And awareness and demand for these apps, and specifically for pregnancy prevention apps, is increasing. MFAM is modern fertility awareness-based methods. It can be based on one or a few methods, commonly on the standard days method, or as well as biometric methods that use basal body temperature or other biometric indicators to predict fertile days. On those days, a user would abstain from sex or use a barrier method like a condom. So of those over 100 apps on the market, most of them are not designed for pregnancy prevention, or do not use MFAM, or are not capable of providing accurate data for pregnancy prevention. Apps that are designed using MFAM actually may be a very effective way to prevent pregnancy when used correctly. The CycleBeads app, developed by the creators of CycleBeads, uses the standard days method to predict the fertile window. While there have been no clinical efficacy trials, a study has found it to be 88% effective in preventing pregnancy with typical use and 95% effective with perfect use. Another example is the DOT app, Dynamic Optimal Timing, and that's a newer version of the CycleBeads app by the same creators and is based on period start dates and then uses machine learning and adapts over time to inform the user of their high and low fertility days. The DOT app does have clinical trial data behind it, and over a 13-month period had failure rates of only 5% with typical use and only 1% with perfect use. So EECO is exploring the potential demand for MFAM apps as a method to fill gaps in the FP market. In the Philippines specifically, only 38% of women who are using a cycle-related method have correct knowledge of their fertile period, which is a key factor in using the method correctly. So to estimate the potential market size for an MFAM app, EECO is conducting mixed methods research to gather insights and understand the potential consumer, as well as developing a model to estimate the demand for an MFAM app. The data that we're using to inform the model comes from a quantitative online survey tool within the mixed methods research. So how did we apply the lessons learned? Step one is the decision pathway. We started by clarifying the intent and purpose of the model. Here, it's developing a case for what is right now a hypothetical introduction of a new contraceptive method, the MFAM apps. Next, determining what outputs we needed. Our primary output here is the total potential market size, and we've broken this down by age categories. We include upper and lower bound estimates of the market size based on responses to the survey. And we will also be able to look at willingness to pay to estimate what the market size would look like at different product price points. As secondary outputs, we can also look at the potential impact of this new method on method mix. And in the unlikely event that there's a MCPR change, we know that new methods tend to not be scaled up enough to drive that. We would be able to look for changes in that as well. The third piece is around the inputs and assumptions that will get us there. So as we mentioned, in many cases, consumer research is the best way to go and is not always possible. We are very fortunate that EECO has the funding to allow us to conduct direct consumer research to determine what potential uptake rates look like among our potential market. We also apply some adjustments to account for overstatements in responses, and we pull in some general population data here as well. So what does our model look like? We start with the total population of women of reproductive age. Here we're using women 18 to 49. The population data comes from World Population Prospects estimate, and the age disaggregations will come from the survey data. We next narrow it down to focus only on women who have smartphone access. As this is a mobile app, we are looking at women who note that they either own or use a smartphone at least once a month, and that smartphone has app capabilities. The next piece is looking at current family planning use. What method, if any, women are using, their satisfaction with their current method, likelihood of using any new method as well. And a note here that these grayed out boxes are those who we are then excluding from the model. So women who have no mobile phone are excluded from the estimate. When we're looking at our family planning use, women who do not currently have a need for family planning are excluded from the estimate. Next is really the crucial piece of the forecast, estimating uptake and conversion rates. So for each method of contraception, we will have an estimated uptake rate of MFAM methods based on interest in the app, likelihood to download, and we'll also be able to apply information on how the app would be used, whether they would use it instead of their current method or in addition to their current method. We do present the MFAM option within the context of the full method mix to ensure that respondents were aware of the entire range of contraceptive options. Finally, we apply, and just a note that these pieces all fully come from the research that we are conducting. Finally, we'll apply some adjustment factors to our estimates to account for satisfaction with current method and potentially for overstatement. As noted, overstatement, there is a tendency for overestimation, exaggeration, and desirability bias when noting how likely someone would be to uptake this new method. And so we will be weighting the factors to account for that. We'll also be weighting satisfaction with their current method, knowing that those who are highly satisfied with their current method may also be less likely to uptake a new method of contraception. Ultimately, this will get us our potential MFAM market size. So there are a few limitations to the application here in the Philippines. One is that There is a focus on the urban online population. Our work is not nationally representative. Because we're doing an online survey, participants are likely not representative fully of the general population. An online population is more likely to have access to smartphones, more likely to be urban. Another key piece here is that we are looking at the market size only among those trying to prevent pregnancy. Because we are excluding those who do not have a need for contraception, this means we are not including those who would be using the app to try to get pregnant. Another major limitation is that at the moment, this is a hypothetical method that we're looking at. So we are asking users in the research about a hypothetical MFAM app, not having them test a specific app and give their responses on that. So with product design, there is no prototype yet. So there's some questions around how often will a consumer interact with the app? What will those interactions look like? And pricing structure, which has not yet been determined, may also ultimately affect uptake or continuation. The scale, what is the fee, a yearly versus monthly fee or a one-time cost? And these are pieces we just don't know yet. And the last piece is that there's not a product introduction plan yet, as this is in the early stages still, but just to note that will further affect uptake rates as well as speed of scale up when we're looking at a demand forecast for this. So just to, I think, finalize and articulate a few of the incorporated best practices. First, we really started off with a clearly articulated model purpose. We were fortunately able to do some very robust consumer research to determine uptake and conversion rates for our modeling. We will be communicating uncertainty with a range of results. Based on our research findings, we'll be providing high and low estimates of market size, as well as our kind of average scenario. We are accounting for overstatement in responses for consumer research. We're applying the discounting factors for both overstatement and consumer satisfaction. And we'll also be considering uptake in the full context of the full method mix. Not only presenting MFAM within the full range of contraceptive options, but also really accounting for method switching as well as for using MFAM in addition to their existing method of contraception. So I think that was a bit of a whirlwind, but I'm happy to answer any questions. Thank you very much.
Thank you so much, Beth, for that presentation. If anyone has any questions or comments, please feel free to raise your hand or come off mute or put your questions into the chat. Any way works. All right, I'm not seeing any. Oh.
Yeah, hi, good morning. Thanks for this presentation, very interesting. This is on Fitzor, and I traveled to Cote d'Ivoire in June, and I had tried to find whether some of these apps were available in French, but when you search for them here in the US, you can't determine that. But I tested it out with a colleague on his phone. I said, hey, look for this app. Is it available in French? And sure enough, it was. And this was this iCycle app. And then we started discussing it both in the team and, demoing it and also with providers. And there was a lot of interest. So, and we also have another partner in Rwanda who's doing some social media promotion of the Cycle app. But I'm wondering, sort of, if there's, I realize you're discussing models and planning, but I'm wondering if there's openness to discussion on what's working for getting the word out on these apps. And for the DOT app, I understand that that's not available yet in low and middle income countries, but are there plans for making that more widely available in the settings that we typically work in? Thank you.
Yeah, thank you. These are great questions. To answer the second part, is correct. DOT is not yet available. That is, why we're kind of using, looking at this as a generic, a demand for a generic MFAM app. Hopefully, should there be demand, that would be a good case for something like the DOT app to, to be made available, or to increase make a good case for it, hopefully, that there is demand for this. And I'm sorry, could you repeat your first question again, or the first part of that?
Well, it was just generally about lessons learned about promoting these apps in various settings. I mean, we now have some initial results of one experience in Rwanda, which of course, when you're promoting things on social media, it spills into other countries. But anyway, I'm wondering if others have experience.
Yeah, that's a great question. I'll note, we haven't, I would say, at least on my end of our work on this, have not looked into much of that yet. At the moment, we are, with the initial market size estimate, we haven't really looked into, we don't have a, necessarily a marketing plan, or have not looked into that yet for this piece. I think, other than with kind of the possibility of considering that this, would this be marketed online? This is something we're looking at of, with this online survey, that we are looking at this online population, but we have not really looked or considered yet with what marketing would look like for this. I'd be interested to know if there are, if there are others either out there or on the call who have had experience with that.
Thanks, Beth and An. Danielle had raised her hand. I think she has also some comments to add. Danielle?
Hi, everyone. Thanks for your question, An. In terms of, so you had two questions there. The DOT app was actually purchased by Clue Birth Control, so it's not available in LMICs yet. Clue was, at the last time we spoke with them, focusing on the US market and then trying to figure out what their plan is to expand to LMICs. It's a big part of their mission to expand access, but we got the feeling that they were trying to get their ducks in a row in the US first. And even though they had received FDA approval, they needed to do a little bit of initial market and beta testing. And then on this second question about what's working, we are still in the data collection phase for our formative research in the Philippines. So we have just done some initial friendship pair discussions, and then we will be launching the big quantitative survey with 1,600 participants in the next couple of weeks. We're hoping to get that off the ground by the end of September. And that will be what provides a lot of the data that goes into the model that Beth described a moment ago. And it's not going to tell us what will work, because we're not actually introducing the app. Like Beth said, it's kind of a hypothetical right now, but it will give us a lot of information about what people think would work, how they'd be interested in learning about it, where they think they would learn about it most effectively, what things would be good to highlight when promoting this hypothetical app, or what will eventually be a real app in the future, or a real app that's available. So I just wanted to note those couple of points, and I'm sure Kendall, who's also working on this project quite a bit, might have some additional points to add. So I'll toss it over to Kendall.
Yeah, thanks, Danielle. Yeah, I was just going to add, and apologies to Beth for being on the spot when we've sort of brought her, I think, into this project a little bit more recently for the demand forecasting part of this. But in the past, and some of you may know, this activity under EECO has gone through some evolution as we've worked through the sale of the app, and kind of come to really understand what the goals were, like Beth was talking about, what our what we're really trying to get out of the forecasting. And before we developed the idea and the plan for the demand forecast model in the Philippines, we did do some some primary research in India, where we had once hoped to do an introduction and a sort of different model of formative research there. And we were able to lead some really interesting focus group discussions with potential users in India, and we never published those results. We didn't because of the way that the activity was evolving. We we were unfortunately never able to take it much beyond that, but we have presented some of those findings at technical advisory group meetings, and I believe we have maybe some slides that we could share. We weren't designing a promotional strategy then, and as Danielle said, we don't know what actually works, but we do have some, because we haven't done the introduction, but we do have some idea, at least in that setting, of some of the features and benefits of the app that women, at least in India, were interested in. So unfortunately, no real life introductory evidence yet, but I think if you are interested in seeing that, I think that we do have maybe some slides that we could share, just of sort of high level findings of what we learned in India.
Thank you, Kendall and Danielle.
Yeah.
There's one question in the chat. What are your priority countries currently and any plans for expansion? And then if anyone else has any other questions, please do put them in the chat or raise your hand. Beth, I don't know if you want to, or Kendall, talk about the priority countries, if you want me to answer.
I will refer to you or Kendall on that. I think you both have more insight into that.
Right, so right now we're only focusing on the Philippines for this consumer insight gathering that we're doing in the research. As Tab mentioned at the beginning, we're going into our final year of the project. And so, this is really helping to inform our demand forecasting model and looking at the demand forecasting with this consumer insight. And we do not have any plans for EECO to expand into other countries at this time. But of course, we'll be sharing the information that we gather and what we learn from this, and how this could be used by others in the future and elsewhere. Are there any last questions or comments? Oh, Baker.
Again, thank you so much, for the presentation, and also for the insights that you have provided in terms of being able to forecast demand. I just kind of wondering, in working with some of the missions that we do interact with, one of the questions that has been coming up of late is we are often asking countries to add one more method to their method mix, introduce this method, and they kind of like always wonder, what should be the basis for them to decide whether to add this extra method, to their method mix? What value is it going to add? How do you see this model being able to help, these countries where, one, looking at it that, they may not have the capacity to collect all the data that, is needed for this, but how do you see this being able to kind of being adapted or adopted to help countries to be able to reach decisions about how to deal with some of these issues when they arise?
Yeah, thank you, Baker. That's a really good question. I think it is, as you noted, I think it can be very context specific. We are really lucky to be able to conduct so much of this research that we're doing here, particularly, I think, around the piece of uptake of this method within the context of method mix, and the additional piece of whether they'd be using this in addition to or instead of their current method. And so we'll really be able to see, will this have an effect on the method mix? Are most people taking this method up those who aren't using a method or users of traditional methods? Or are we getting a number of method switchers from, already existing effective modern contraceptive options? And of course, women should, we want everyone to have access to a method that best fits their needs. But I think that's also important to to look at and consider as well, especially as far as the possible health impact of a method are these methods switchers from a highly effective method, or is these, new users of a modern method? When applying that, I think, to situations where we don't have, the ability, the time or resources to do this kind of funding and research, I think we'd really want to look at, ideally try to find some sort of a proxy product that there might already be data for. And I think this one, is a little, for the MFAM, might be a little trickier, as there's that online digital element. But I think choosing a proxy product and being able to look at what we know about that product, who uses that product, is there any existing, was there any kind of forecasting work done to estimate, uptake rates or conversion rates for that proxy product, and kind of apply that to the potential method that you're looking at introducing. And there's I think a whole set of recommendations and best practices around choosing, how to choose a proxy product and applying that data. But I think in the absence of being able to conduct this consumer research, I think trying to find the best proxy product that you can, and apply some of the data from that would be the way to go.
Thank you.
We have another question in the chat from An, who's wondering if, I'll just read the question for you. In terms of modeling, what proportion of traditional method users report willingness to switch to an MFAM? What are some of the ranges you've seen in the literature? Or are you waiting for the data to figure this out?
We are waiting for the data. We are just started the initial conducting our research in, I think, the end of August. So we're waiting for the data to have that, and we will be able to tell you among our population exactly what those proportions are, but we don't know that quite yet.
Thank you, Beth. And Kendall just clarified that although we had started in India with these initial discussions and hoping to do this same research in India, it has actually switched to the Philippines, which is where the research that Beth just mentioned has started. Any last questions? Well, thank you to everyone who has joined us today, and to Beth for this presentation. We will be sharing the slides with everyone. And of course, if there are any other questions or comments or anything comes up, please feel free to reach out to any of us on the EECO team, and we'd be happy to respond or put you in touch with the person who could respond. And then An just says that she's thinking of a completely different country with high traditional method use. So not sure how translatable those results will be from one context to another. Yeah. All right, well, thank you to everyone who participated. We will also be making this recording available on the Catalyst Global website. We'll share that link around when we share the slides as well. So thank you to everyone, and have a good rest of your day or evening, depending where you're at in the world.
Thanks, everyone.
Thank you.